Hi, my name's Professor Sharon Abrahams and I head a lab at the University of Edinburgh which investigates cognitive changes and changes in behaviour in people with motor neurone disease. Now, in some people with motor neurone disease, certainly not all, the disease does not only affect the system that controls movement and muscles, but it can also affect how people think and they behave. And this is because in some people, the disease also affects the frontal lobes of the brain. And so over the last 25 years, I've been investigating these particular changes in people. And we find that in most people, it's very subtle, the changes. And they may be changes in how they make decisions or whether they can pay attention to two things at once. Or it may be that they become a bit more apathetic. They don't want to do things, don't want to think of things. In some people, those changes are much more marked. And in those patients, they have a dementia syndrome. So, as I say, we've been investigating this for quite a long time. We assess people, we may give them a scan of their brain to see where those changes are. And we try and look exactly where the specific areas of damage are. Now, we've developed some new tests which measure these changes, one of which is called the Edinburgh Cognitive and Behavioural ALS screen, and this is a short assessment that we can do in the clinic. And it takes about 20 minutes to perform, and it's just like a series of memory, problem-solving tasks. And using this measure, we can identify very quickly whether someone has those difficulties. And what we're trying to do is we're now trying to really roll this out nationally so that most people with MND, once they're diagnosed, they'll get a very quick assessment so we can identify whether they've got those specific problems. And why that's important is that if they do have those problems, we can hopefully help them to adjust to those difficulties, giving advice to both the person with MND and their carer.